7 symptoms of renal disease. Kidneys are a very important organ for our body. They are 2 small stamens that resemble the shape of a bean. It is located behind the abdomen and under the rib cage in our body. It cleans and filters water, wastes, and acids from the blood. It turns these wastes into urine for removal from the body. It keeps the minerals necessary for our body, especially salt, potassium, magnesium, water, glucose, and protein in balance. Don't forget to support us by liking, commenting, and subscribing before moving on to our video. Our kidneys, which are very valuable for our body, have many important tasks. It keeps blood pressure in balance by secreting the hormone renin. In addition, with the help of the erythropoietin hormone they secrete, it stimulates the bone marrow and helps blood production. By ensuring the use of vitamin D taken into the body, it balances the rate of calcium and phosphorus in the blood and contributes to a healthy bone structure. If you have these 7 symptoms, you may have a problem with your kidneys.
1. Quick fatigue, nausea and vomiting. While doing your normal daily work, you should pay attention to whether you get tired quickly and whether you experience nausea and vomiting in your stomach frequently. 2. Change in urine appearance. When you urinate, you should pay attention to whether the color is red, bloody, and very foamy. 3. Change in urination habit. If you experience excessive increase or decrease in the amount of urine, burning when urinating, and frequent urination at night, you should pay attention. 4. Swelling of ankles, hands, and face. If you experience noticeable swelling in your ankles, hands, and face, you should pay attention. 5. High blood pressure. If you have high blood pressure when you regularly measure your blood pressure, you should pay attention. 6. Shortness of breath and difficulty breathing. If you are experiencing difficulty in breathing and shortness of breath while doing your daily work, you should pay attention. 7. Taste disturbance and foul-smelling breath. If you cannot taste the foods you have tasted before and if your breath is constantly smelling bad, you should pay attention.
If you are experiencing all these symptoms, your kidneys may not be healthy. In this case, you must protect your kidneys and ensure that they do not lose their functions. A decrease in kidney functions below a certain limit indicates chronic kidney failure. The important thing is to intervene before kidney failure develops. The remaining cells in the kidneys do not renew themselves, on the contrary, they progress and get worse. If there is a kidney failure process for more than 3 months, it means chronic kidney failure. Since it causes chronic kidney failure, anemia, osteoporosis, and heart diseases, it is life-threatening if left untreated. Kidney failure can occur at any age and in any gender. According to scientific studies, it has been determined that kidney failure is more common especially after the age of 40.
Do these 7 things to protect your renal health. 1. Eat healthy and limit salt intake. Americans eat on average about 3,400 milligrams of sodium per day. However, the Dietary Guidelines for Americans recommends adults limit sodium intake to less than 2,300 milligrams per day, that's equal to about 1 teaspoon of table salt. Instead of processed foods and fast food style diet, fresh vegetables, fruits, and home meals should be consumed. Do not neglect your regular checkups.
2. Protect your kidneys by consuming enough water. The U.S. National Academies of Sciences, Engineering, and Medicine determined that an adequate daily fluid intake is about 15.5 cups, 3.7 liters, of fluids a day for men. About 11.5 cups, 2.7 liters, of fluids a day for women. This amount of fluid should be increased during exercise, febrile illnesses, pregnancy, or breastfeeding. Kidney failure may not show any symptoms in the early stages. For this reason, the most effective way to detect the disease is to perform blood and urine tests at regular intervals.
3. Quit smoking and stay away from smoking environments. Smoking, which affects almost all organs in the body, slows down the blood flow to the kidneys. It is possible to slow down and treat kidney failure with early diagnosis.
4. Do not use unnecessary painkillers and antibiotics. Since painkillers and antibiotics taken unconsciously cause kidney failure, they should not be used outside of the doctor's control.
5. Exercise regularly. 30-minute brisk walking and regular exercises 3 to 4 times a week reduce blood pressure and prevent kidney health from deteriorating. Almost half of people with diabetes can develop kidney failure over time.
6. Find out the cause of stones and urinary tract infections. Analysis of dropped stones must be provided. Again, the cause of urinary tract infections should be determined. If one or more of these risk factors such as diabetes, high blood pressure, overweight and a history of kidney failure in the mother, father or close relatives, kidney functions should be checked every 6 to 12 months.
7. Track your blood pressure. Your blood pressure should be kept under control with lifestyle changes such as regular walking and salt-free diet. Blood sugar should be checked at regular intervals.
Natural foods to protect your kidney health. Lemon. When natural freshly squeezed lemon juice is consumed during the day, it alkalizes the body, removes the acids accumulated in the body, and balances the pH level. Lemon juice, which is a store of vitamin C, supports the protection of our immune system. Thanks to the citric acid in the lemon content, it creates an environment in our body where kidney stones cannot form. You can drink a mixture of olive oil and lemon juice on an empty stomach in the morning. You can watch my video on how this mixture is prepared. Parsley. While folate with vitamins A, C and K in its content strengthens your immune system, vitamin A has a direct effect on lymphocytes and white blood cells. Containing chlorophyll, parsley has antibacterial and antifungal properties. It is a natural aid in cleansing the kidneys. It is very useful in the treatment of kidney stones, gallstones, bladder infections and urinary tract infections.
Carrot. Nutritious and delicious, carrots contain beta-carotene, fiber, vitamin K1, antioxidants and potassium. Converting beta-carotene to vitamin A, carrots are an important source of nutrients for immunity. It also supports eye health. Carrot, which contains vitamin K1, improves bone health by providing blood clotting. By drinking carrot juice regularly, you will protect your kidneys. Grapefruit. Grapefruit, which is also rich in folates, also contains niacin, pantothenic acid, pyridoxine, riboflavin, thiamine, vitamin A, vitamin C, vitamin E and vitamin K. Grapefruit and lemon juice are the #1 enemy of kidney stones. Watermelon and watermelon seeds. With its nutritious feature, watermelon contains high levels of vitamins A and C, and minerals such as calcium, magnesium, potassium, iron, phosphorus, copper and manganese. Especially in the summer months, you will protect your kidneys with watermelon and seeds.
Spinach. Spinach contains plenty of vitamins C, E and B, magnesium, iron and calcium. Therefore, it has high nutritional value. By mixing spinach juice with lemon juice from time to time, you can protect your kidneys by consuming it in the morning on an empty stomach. Celery. Celery is a very rich source of vitamins and minerals. Celery is a vegetable that contains high amounts of vitamin C. Apart from vitamin C, it also contains sodium, phosphorus, potassium, calcium, magnesium and iron minerals.
If you'd like to learn more about top 10 foods to unclog your arteries naturally, check out the video that I've put on your screen. Now thanks once again for watching another of my videos. I wish you great health, wealth and happiness.